Good afternoon, everyone, and welcome to this webinar. As we get started, I'd like us to get started with a short prayer. So if we could please center ourselves and remember that we're always in the presence of God. This is a prayer for climate change written by Jane Darren. Your creative love, O God, brought forth our world, once a garden where humans could taste and see the goodness of the earth. But our eyes have been blinded to the beauty of creation, to the knowledge that it is a gift, one given so that all humans may live and flourish. Our indifference changes the world. Even mighty glaciers weep now. Our disregard for our sisters and brothers threatens the very skies above us. Our passivity is choking us, and the excess of our lifestyles blots out the sun. Call us to renewal, to stewardship. Call us to solidarity to the earth and all of its creatures. Give us new vision to see the fragile beauty that remains. Give us new spiritual energy to become active in loving the world through our daily life. Give us new voice to speak out for environmental solidarity. Bless us again with the gift of being a joyful community. Bless us with a love of your creation, and we will glimpse your Eden once again. Amen. This is Paz Artaza Regan, Program Manager at Catholic Climate Covenant, and good afternoon. Welcome. We are here for the webinar called The Growing Crisis, Climate Change's Impacts on Human Health. As we hear today's presentation, I ask that you think about the myriad of health impacts that climate change has and how it's presented in this webinar, and consider how we can frame and discuss this issue as a pro-life issue. I'd like to extend a special thank you to our partner group, the Catholic Health Association, for helping us put this webinar together. For those not familiar with Catholic Climate Covenant, our mission is to inspire and equip Catholic people and institutions to care for creation and care for the poor. Through our 16 national partners, we guide the U.S. Church's response to climate change by educating, giving public witness, and offering resources. Some important information before we get started. The video is being recorded, and it will be sent, as well as the PowerPoint, to all of you who registered. We will have a question and answer session after the presentation. You can submit your questions by writing them in the chat box on the lower left side of your screen. You may need to scroll down to see at the bottom where you can type your message. We ask that you please do not fill the box with conversation, but limit it to questions. That way it'll be easy to find the questions when we get there. If we do not have time to get to all the questions, staff will endeavor to answer all of the questions after the webinar. At this point, it is my pleasure to welcome and introduce Dr. Laura Anderko. Laura's got a PhD and is a registered nurse. She holds the Robert and Kathleen Scanlon Endowed Chair in Values-Based Healthcare at Georgetown University School of Nursing and Health Studies, and serves as director of the Mid-Atlantic Center for Children's Health and the Environment. She earned her bachelor's in science in nursing and PhD in public health from the University of Illinois, and her master's in community health nursing at Northern Illinois University. She's a scholar, educator in the fields of epidemiology, public health, and environmental health. Dr. Anderko has published extensively in the area of public health impacts from environmental exposures. At this point, please extend a warm welcome to Dr. Laura Anderko. Laura?
Thank you, Paz, for that wonderful introduction and lovely prayer. I look forward to spending the next 35, 40 minutes with all of you to talk about the growing crisis, climate change's impacts on human health. We'll begin with a conversation about climate change, the scientific basis for what we know, And in the end, talking about solutions. In between, we'll talk about those health impacts, and we will leave with solutions and things, simple steps that we can take even today. Pope Francis, in his encyclical on ecology in June of 2015, said that climate change is a global problem with grave implications. It represents one of the principal challenges facing humanity in our day. A great cultural, spiritual, and educational challenge stands before us, and it will demand that we set out on the long path of renewal. And so we'll begin our conversation and our discussion exploring why climate change is a critical issue for people of faith, how climate change is impacting human health, steps we can take to reduce our own impact on climate change, and what we can do to address health problems related to climate change. The Catholic Climate Covenant has a wealth of information on their website that I will be referring to throughout the presentation to help provide some guidance and information about how we might begin to make some positive changes around climate change. The St. Francis Pledge says that we pledge to pray, act, and advocate to solve climate change. In praying as an individual or a group, we can set a regular time to prayerfully consider our own contributions to climate change and for the resolution to lessen our impacts. Also praying with Pope Francis's Laudato Si, which is also available online, and to discern how your community's liturgy can reflect a care for creation and the poor. Another way to be mobilized is to act or educate yourself and others on the issues of climate change. Calculate your carbon footprint. Again, the EPA has a little calculator, and you can find that link on the Catholic Climate Covenant's website. Consider some cost-free ways to lower your energy use, and we'll talk about those later on in the discussion. Something as simple as turning off the light when you're not using it, or turning off your computer is one simple way. Investigating renewable options, and we'll talk about wind and solar power, among others. Learning how climate affects the vulnerable. We'll be spending a little bit of time talking about those most sensitive to these climate changes that we're experiencing. And the last step is to advocate. Sharing the pledge with family and friends, which seems like Thanksgiving week seems like a perfect opportunity to do that. Giving thanks for our wonderful earth and helping people become more aware of personal actions and how we might move forward in making positive changes. Discussing your vision with your pastor, letting your local, state, and federal officials know that you are concerned about climate change. The Catholic Climate Covenant website, we'll talk later, actually has how to write an op-ed and how to write a letter to the editor. So as we move into the science of climate change, it's important to note that this has been studied for decades. There is a nonpartisan intergovernmental group called the Intergovernmental Panel on Climate Change, which is an international group that has been collecting all of the research and coming up with recommendations based on the science. Way back in 2007, it made what seemed like a very bold statement that the warming of the climate system is unequivocal, that we had not seen anything like it in all of the records and all of the human history and data that had been collected. Every 7 years they put out a report, and in 2014 they underscored the statement with additional data and additional science stating that our climate is indeed warming, and it continues to break records. So when we talk about climate change, what are we actually talking about? Climate change is related to human-enhanced greenhouse effect. So as we look at the slide on the left, we see that there's a natural greenhouse effect that quite honestly, we enjoy as human beings, plants, animals. We don't like it too cold, and this creates an environment that's actually good for us, for growth of trees and plants, etc. However, on the right side, you'll see the red band of greenhouse gases, carbon dioxide, methane, nitrous oxide. These gases trap the radiation from the sun. So the sun provides us heat and warmth and light. Instead of it being redirected back out into space, unfortunately, these gases trap it. And what happens is that solar radiation begins to warm the planet. And we'll talk in a little bit about what are the signs and symptoms of global warming on our planet itself. It's always important to understand where the sources of these greenhouse gases come from, particularly if we want to take personal steps in reducing our contributions, and also if we're looking at policies by which we might be able to reduce some of these greenhouse gases through policy. You can see that in the pie chart, electricity contributes as much as 30% of greenhouse gas emissions, mostly carbon dioxide. And this is from carbon produced as a result of production of electricity in coal-fired plants. And so you may have heard of the Clean Power Plan, which is President Obama's initiative to help reduce carbon pollution from coal-fired plants. Just below that is transportation at 26%. We all drive cars. Some of us drive cars that emit more than others. But we do know that transportation is a huge contributor to greenhouse gases, in particular carbon, again. And just a simple trip to the food store for a jug of milk, those emissions can last from 50 to thousands of years in our atmosphere. So every time we hop in that vehicle, we are contributing to many, many generations beyond ours with that pollution. The next pie slice is industry at 21%. And this is everything from cement production to hospitals. And our next slide, I'll be outlining some of the specific issues around hospitals. Hospitals are second only to coal-fired plants in its carbon footprint. They're open 24/7. They use a lot of electricity and a lot of power and a lot of energy to help us heal. And we will talk about hospitals because it is aligns very nicely with our own personal lives and how we use energy. Commercial and residential is at 12%, that's homes and businesses, and then agriculture at 9%. A lot of people are surprised by that, but methane, one of the top 3 greenhouse gases, is produced in abundance by cattle that we raise for our beef. And if you happen to see the movie Before the Flood, there's a really great presentation within that film by Leonardo DiCaprio about methane and the challenges and issues around cattle production. So as promised, this slide helps us, I think, focus a bit on those top 3 greenhouse gases. Hospitals generate, as I said, emissions in a variety of ways, and we can all look to this slide as opportunities for us to look at our own personal contributions. And diet is huge. Great book out called Diet for a Hot Planet. The whole book talks about how we transport food, how we raise food. And as I said, beef is really big. And so one of the recommendations that I'll talk about at the end is to go meatless on Fridays or meatless on Mondays, or trying to become better at a plant-based diet, which is quite frankly better for our health too. Transportation is a huge issue. We live in a society, in a country where cars get us around, and the use of vehicles has created not only traffic jams, but also air pollution. Hospitals are getting better at creating natural buildings with natural daylight so that they're less dependent on electricity. We can learn a lot from that by opening up the shades and letting the light in, and using less energy if we don't need to. Uh, Coal-fired plants, again, the more electricity we use, the more pollution is created. So we need to be cognizant of how much electricity we actually use. And hospitals are unique in that they use a lot of nitrous oxide, which is a greenhouse gas. Unfortunately, hospitals emit this gas directly into the environment, so that local community is getting an extra dose of one of the top 3 greenhouse gases. So as we move into an overview of climate change and health, I think it'll be important for us to think about these sources and think about the benefits of us reducing those greenhouse gases. Um, let's move to the next slide here. This slide comes courtesy of the Centers for Disease Control and Prevention. What I want you to focus on in this slide to begin with is that center circle. And what this shows us are the signs and symptoms of illness in our planet. So we're seeing rising temperatures, more extreme weather events, rising sea levels, and increasing carbon dioxide levels. These all in turn create other situations in our weather and our climate changes that impact our health. Everything from severe weather and air pollution to increasing allergens, water and food supply impacts. All of these then in turn impact diseases. And so with air pollution, as the temperature goes up, air quality goes down. And so we see an increase in ozone and particulate matter. So on those really hot days, we see more people coming into the ER with asthma, cardiovascular disease, myocardial infarction, or heart attacks. As we look at rising temperatures and conditions favorable for vectors such as mosquitoes and ticks, we're seeing an increase in malaria, dengue fever, hantavirus, Lyme disease, West Nile virus. And so we'll be talking about many of these diseases and illnesses that are on the rise as a result of our changing climate. So air quality impacts is probably the most studied as it relates to climate change. We know particularly sensitive groups such as children who have developing lungs and bronchioles, that they are very susceptible to changes in air quality. We're seeing a huge increase in the number of children in cities that are being diagnosed with asthma and allergies. We also know with the droughts in the Southwest, and actually, quite frankly, across the country, we're seeing an increase in wildfires. The smoke can impact people hundreds of miles away. And so we're seeing, because of the particulate matter and the chemicals in the air, huge increases in people that are seeking help, healthcare, because of the air quality issues. We also know that as the temperature increases, we also see the formation of ozone. This is a major lung irritant. People who have asthma say it feels like their lungs are on fire. And so we do know that there is a great deal of people, particularly sensitive populations, who are very sensitive to these changes in air quality. Vector-borne diseases. The top right corner of this slide shows Lyme disease under the microscope and how it presents itself in a clinic situation, the bullseye, and then the deer tick that carries this. This is one example of many vector-borne diseases that we're seeing an increase in. It used to be very localized in the Northeast and in the Midwest. The geographical range is expanding because of the warming, and so we're seeing these vectors much wider geographical location than in the past. And the CDC has excellent maps on their website to see over time how these ranges are expanding. On the left is the Anopheles mosquito, one of many that transmit malaria and West Nile and Zika. And of course, we're seeing an increase in tropical diseases in areas that we never would have thought could get tropical diseases. And again, that's due to the geographic range expanding due to global warming. Another highly researched area is temperature-related death and illness. And we can say with confidence that our temperature, particularly our summer temperatures, continue to break records over the last several years. With this comes changes in our planet and changes in how we are impacted by a variety of ways. The top middle photograph is of a young high school football player who died from heat stroke during a football practice. You might think that this is an unusual occurrence, but it actually has been written up even by coaching literature about how coaches need to change their routines in the summer month of August because of the high risk of heat stroke and death. On the right is a book that was written about the 1995 heat wave in Chicago. I was actually born and raised in Chicago and was there during this time. A very hot summer, a city that was unprepared, elderly people who could not afford air conditioning, turning on their fans and quite frankly, cooking themselves to death. There were hundreds of deaths. And the city needed to use freezers that they had set up for the Taste of Chicago as a morgue because so many people died in such a short period of time. The good news is that cities across the country are recognizing the need for cooling centers, for community workers to go and knock on neighbors' doors, and to help us, particularly those very sensitive, such as the elderly, to adapt to these changes. They're happening quite quickly, actually. The bottom right is a picture of poison ivy. Poison ivy loves carbon dioxide and loves heat. There was an article written in the Washington Post about climate change and poison ivy. The author's son had been hospitalized several times. Couldn't figure out where he was getting exposed, but his dog had run through a field with poison ivy and it kept reinfecting the boy when they slept in bed together. The point is that the leaves are larger, the poison is more virulent, more potent, and so more and more people are getting reactions to even minor brushes with the plant. The left is a picture of ragweed. More and more people are being diagnosed with allergies. Part of this, again, this has been studied very closely in the lab. Carbon dioxide and heat is the ragweed's friend, so much so that it not only repollinates over a season, the pollen is larger and more allergenic. So we're seeing more and more people respond negatively to the ragweed pollen. And finally, the upper left-hand corner, a colleague of mine in Alaska has been doing research on Hymenoptera, which are wasps and bees, and their stings. He's an immunologist and found a huge increase in the number of people being admitted to the ER over time. Upwards, one county was over 626% more people being admitted. Part of the reason is that the vectors can overwinter now because there is no hard freeze. And so we're seeing a loss of the cold weather that was typically seen in portions of Alaska, and a reaction to the environment, to the vectors that is impacting human beings. Water-related illness. You may have heard, I think it was last year in Ohio, there was a big news story about algae blooms, which you can see in the upper right-hand corner of this slide. Algae blooms are a result of warming water and nitrogen from agricultural fields and grass. When we fertilize our grasses, that mix creates a very toxic type of algae. In some states, such as Wisconsin, they actually have pamphlets and brochures about avoiding algae blooms and making sure your pets don't jump into it because it can cause death. And in Ohio, there was a lot of conversation about safety of the drinking water. In addition to the algae blooms, there are a lot of bacteria that can increase as a result of the warming water. And in some parts of the world, we're seeing an increase in cholera. Food safety, nutrition, and distribution. We don't really think in the US, we're pretty fortunate to be able to go into a food store and just buy whatever we want. The reality is that even here in the US, agricultural practices are having to change. In some cases, families in the Midwest are folding up their farms and moving on because of the periods of drought and flooding that occur are not conducive to growing the traditional crops that have been grown. And so we're seeing this worldwide. Undernutrition is one of the most significant health concerns related to climate change. As climate change continues, low crop yields, increased foodborne illness, increased crop losses, and altered nutritional content of food can be expected. Extreme events is another serious concern. Think Hurricane Katrina, Sandy, recently Matthew. There are a lot of issues around extreme events. Of course, the obvious is losing your home, injury, but there's also reduced access to safe drinking water and food, increased risk of infectious disease, and honestly, those that need medical attention are not able to get it. And so extreme events can create a whole series of issues when communities are broken and fragmented and services are no longer available. A recent study found that during extreme events, whether it's a wildfire or a flood or a hurricane, child abuse goes up 5 times for kids under the age of 2. A lot of this has been linked to parents feeling lost and not supported. And so there are those hidden health issues as well that we don't often think about when we think of extreme events. Mental health and well-being. Post-Katrina, there was a concern about climate refugees, and I know there's a webinar coming up next month about climate refugees. I was living in Wisconsin at the time and remember hearing about plane loads of people coming to the area to restart their lives. I don't know if you've ever been in Wisconsin versus Louisiana, but the cultures are very different. The weather's very different. People lost not only their homes and some of their family members, but their community support and the life that they knew. And so there has been a fair amount of research that is emerging. Post-traumatic stress disorder is the most commonly studied psychological outcome in relation to climate-related disasters. Depression is the second most commonly studied mental health outcome among survivors of natural disasters. Again, this can be resulting from hurricanes, wildfires, etc. Pope Francis, in his encyclical, stated that many of the poor live in areas particularly affected uh, by phenomena related to warming, and their means of subsistence are largely dependent on natural reserves and ecosystemic services, such as agriculture, fishing, and forestry. And so, again, some of the things that many of us are protected from because of the world that we live in, we often don't think about exacerbation of poverty, people not only losing their homes, their livelihood, their jobs, their communities. And some people become ill and are not able to go back to work. This photograph actually was taken on a social justice bus tour I attended a couple of years after Katrina. Unfortunately, this community was going to court because the community was built on a toxic dump, and people were being diagnosed with cancer. Their day in court was actually the day that Hurricane Katrina hit. And so many of these people that survived Katrina had to go back into their homes and were unable to get their homes fixed. And so there was a lot of this in that particular neighborhood in New Orleans. Populations of concern. We talked about the elderly, children, of course, because their bodies are growing and they're less able to get themselves out of the heat, hydrate themselves, regulate their temperatures, but also Native Americans. Their homes, many tribes are being relocated. Permafrost is melting in Alaska, causing whole communities to tumble. And we don't hear about that, but it's happening right now. And so we need to think broadly about these climate impacts and those most vulnerable to their way of life. So what can we do? Well, we can always start with ourselves, and starting small is always good. We can set an example and live by example. And so this slide shows us some of the things that we need to do if we're not already doing them. In the bottom left-hand corner, it's a call to be energy efficient and to really think about whether we need to take that car solo or whether we can carpool, whether we can telecommute, whether we can take a bus or a bike or even walk to reduce the emissions from vehicles. Another important way to be energy efficient is to choose renewable power, right? To think about wind power and solar power. How might we utilize alternative renewable power through our companies, through our people that provide us our electricity, etc. The top photograph is re-emphasizing a plant-based diet. It's really much better for us health-wise, and it's much better for the planet. One head of cattle uses gallons and gallons of water and feed. Many countries, poorer countries, are devastating their rainforests to raise cattle. So eating less beef is a really good way to help reduce our footprint. In the center, we have somebody who is recycling. really a great idea for us to trim our waste, put ourselves on a plastic diet, as well as really uh, using less, consuming less. All of that trash goes into landfills, which produces methane. And so it's always better for us to, you know, reuse our bottle, not reuse a plastic bottle, but use our own water bottles, etc., and take a diet from a break from all the plastics, etc., that we use. The right-hand corner is to remind us to plant trees. Trees love carbon. Trees shade our homes. Trees provide a wonderful balance for our planet, clean our air. And so rather than cutting down trees to build stuff, let's think about planting more trees. So as I promised, we're moving into the end of my portion of the presentation, is to remind us to take the St. Francis Pledge that will help us to care for our planet and our most vulnerable sisters and brothers. On this web page, you'll find links to action alerts to make a difference. You'll find a link to carbon reduction strategies to live justly on the earth. And you'll also see updates on Catholics that are leading the charge to solve climate change. Pope Francis said, as part of his encyclical, there is an urgent need to develop policies so that in the next few years, the emission of carbon dioxide and other highly polluting gases can be drastically reduced. For example, substituting for fossil fuels and developing sources of renewable energy. So, what are some of our resources? Again, the Catholic Climate Covenant has an encyclical toolkit, and within that is a whole number of resources. This particular photograph is a diagram that you can use on Facebook or Twitter. This one states that many faiths, one earth, we stand with Pope Francis on climate change. Within this website, they list 5 items that we should think about. The first is to understand the encyclical. Find quotes, just as I've been using in this PowerPoint, on ecology, and find links to the encyclical and news coverage and analysis to better understand what this means and how it links to climate change. Talk about it. I noticed that some of the comments and questions are about our new administration that's coming into the White House. This is not the time to be silent. This is not the time to be introverted. We need to talk about it. We need to talk about it through sermons, through social media, through tweets. There are guidelines on hosting a discussion, submitting letters to the editor, as I mentioned earlier. We need not to put the ketchup back in the bottle, if you will. We need to continue to talk about it respectfully, particularly with people who don't believe the science. Everyone knows somebody with asthma. Everybody knows somebody and has felt the heat. Making those connections to health is a very important tool because everybody wants to be healthy. Nobody wants their kids or their grandkids sick. If we can make the conversation about its impact on health, we will be successful. I know this from decades of talking about other issues, chemicals, etc. When it impacts health, people listen. Stand with Pope Francis. Number 3, join us in standing with Pope Francis by adding your name to pledges provided by Catholic Climate Covenant and Interfaith Power and Light. Again, if you go to the website, you'll see a whole list of people who have made the pledge and organizations. Number 4, start a team and go green. Paz has a slide or two that will hopefully help inspire you about forming a green team, a creation care team uh, that will help you lead the charge to address climate change. Number 5, take action. Participate in advocacy to ask Congress to support the Green Climate Fund and to help the nation suffering most from the effects of climate change. Again, as we move into an administration with different viewpoints, we just need to speak more often, speak louder, and be prepared with information to make the case. There are two books that are free that you can get off Environmental Protection Agency's website. The left one, Climate Change Indicators, this is work done with NOAA and specifically outlines the warming trends that we're seeing. The one on the right speaks specifically about impacts of climate change on human health in the United States. And you can order those for free through EPA. You just have to, you'll see when you go onto the page with the booklet how to order those. I also want to put a pitch in. As director of the Mid-Atlantic Center for Children's Health and the Environment, we have information for families as well as health professionals on a wide range of environmental exposures, including climate change. Check out our website, give us a call if you have any questions. There's also other ways to contact us on our website. You'll see some helpful information that might be useful as you create your green team. But we're there, we're funded through the Centers for Disease Control and Prevention, and we're there to help answer your questions. And we also do outreach education if you're interested in that. And so my last slide is a final quote from Pope Francis. These are the mountains in Shenandoah, where I'd love to go to just kind of clear my head. Nature cannot be regarded as something separate from ourselves or as a mere setting in which we live. We are part of nature, included in it, and thus in constant interaction with it. So we need to not separate ourselves when we talk about things such as climate change. We're all part of it, and it's impacting us as much as we're impacting it. So with that, I will turn it over to Paz. She may be on mute. I'm not sure. Just going to give her a few more minutes.
Okay, that's better, right?
Yeah, I can. Thank you.
Good. As Laura said, that the Covenant has a lot of information on its website, and we invite you to go and look through it. This webinar was really meant as an introduction to the issue. If any of you need a little bit more in depth, please call me and I'll put you also in touch with Laura. And we can also talk about future webinars that do go in more in depth. But let me right now talk a little bit about our Creation Care Teams program. One of the actions that you can address to the issues that are discussed in this webinar is to start a Creation Care team within your parish, school, workplace, or religious community. And a CCT, as we call them, is a group of people that will work together to make a difference in your community by sharing information, creating sustainable facilities, advocating for faith-based and faith-informed climate policies, and praying for God's creation. What does the Covenant provide? Once you register as a Creation Care Team, we provide a monthly resource email that contains advocacy information. It contains hands-on activities and ideas for your team to undertake, links and resources and information, and a reflection piece to spur discussion at your meeting. In addition, you get basically wraparound support. So you can call me at any time and I'd help you troubleshoot problems, brainstorm projects and programs. We also provide a group. It's a closed group where you can share successes and challenges with other CCTs in the community. And finally, your group will be able to access the resource library, which has toolkits that guide you from getting started to being able to communicate with your community, to getting other people involved, and how to keep going as a team. I really ask you that you look at what the CCT program is, because it really is a way for your community to start getting involved in these issues and digging much deeper and bringing people together on this at the local level. If you're able to put information in your bulletins, if you're able to have educational meetings, if you're able to have film festivals, if you're able to go around and do waste reduction programs, those are all things that will pay off in the long term. Also, from the questions we're getting, I really want to also mention two new programs that are coming up. One is what is called the Pastoral Training Program, and this one is in a pilot stage. This is a program to train pastors and deacons on Laudato Si, on creation care, so that they can feel empowered to talk about these issues. It is going to be rolled out nationally. Right now it's in 4 places and going on further in the next year. And the other program that I want to highlight also is Catholic Covenant Energies. That is also a pilot program to make your facilities more sustainable, where people will be able to come in and get into a revolving fund, loan fund, to be able to do the bigger projects in your facilities. All those things are on our website, and I would really urge you to look at them. At this point, we're going to switch gears, and we're going to go to the question and answer section of our program. So let me go back up here, and Laura, I've got a few questions for you. The first one is Kevin in Virginia is asking the question about hospitals and how the hospitals themselves can achieve reduction in greenhouse emissions. What role does public policy play versus, I guess, what role does the church play in getting Catholic hospitals to be greener?
That's a great question. There is a group, an international group called Healthcare Without Harm. And if you go to noharm.org, their main focus is getting hospitals to reduce their greenhouse gas emissions. There are a number of Catholic hospitals. Quite frankly, Catholic healthcare has been leaders in this area. And as I briefly mentioned, using natural daylight, more windows, less electricity, less lights, not only improves healing of the patient and is better for the staff, such as the nurses, but also reduces energy cost. And so they're finding there's been a lot of interesting data collected from these hospitals indicating a huge significant amount of cost savings once they begin reducing greenhouse gases through some of these initiatives, such as using natural daylight. So healthcare without harm, and there's lots of policy. As I said, they're international, so the focus is not just on U.S. hospitals, but abroad as well.
Okay, great. Thank you, Laura. The next question is Mary from New Hampshire. She wants a little bit of an explanation when you talk about the words vector-borne diseases. And can you explain why it's called that?
Yeah, so it's a public health term, and vector actually refers to a whole range of critters, everything from insects to mice to rats, that transmit, they're carriers of diseases. And so these vectors can, as a result of climate change, primarily they're insects, will carry these diseases. And without that vector, you don't get the disease. So if there's not a mosquito, a particular kind of mosquito, then you're not going to be at risk of Zika, for example. And so you need that vector to create the link between that disease and that human being. That's a great question.
This question has a public policy bend. What is your opinion about how much the new administration will have success in advocating or not advocating for climate change, given the president-elect's position that climate change is a hoax? And I can follow up if you like.
Sure. So this has been, of course, in my world, this has been like a daily conversation. You know, we have come so far globally, internationally, in our research, in our commitment, the Paris Accord, et cetera, that one can deny it, but it's here and we're experiencing it. There are lots of things already in play. You may or may not know. So I live in the district. They have a floodwater barrier that was built underground that can come up when the waters get high. This was started during the Bush administration when there were climate deniers as well. And so my hope is that you know, it's not just going to be science that pushes the mark. It's going to be passionate conversations, people such as you that are mobilizing grassroots efforts with a view on faith and earth and care for creation. It's going to make a huge difference. And so, you know, I fundamentally, you know, believe that our democracy and our government will eventually do the right thing, but it's going to be a hard sell in the beginning because it is not seen as being economically good. The reality is there is a lot of data out there, including health data, productivity data from workers, data around savings when we're looking at energy, renewable energy, that the case is there. We just have to make it stronger. And so it's unfortunate that we're going to take a few steps back in trying to make the case. But I think ultimately the voices and the information and quite frankly, the changing climate will make a difference. Great question.
Yes, it is a great question. And I'll just add that from everything that I've read and heard and we've talked about, these next few years may be challenging, but it's not like it's going to be a clearing of all environmental and climate change issues. Even if there is a suggestion about getting out of Paris or not doing the Clean Power Plan, the steps to that are going to be very hard as well. So advocacy, advocacy, advocacy is going to be what is called for in the next few months. So just want to put that on people's agenda. Here's a question, Laura, that's more about you work in a Catholic institution, specifically Georgetown. And Kevin wants to know what kind of things Georgetown University has done to commit Catholic spirituality to its response to climate change.
Actually, Georgetown has, in my personal opinion, has done a phenomenal job. As you know, we have a set of values that guide our teaching and our work. And so, you know, care of the common good, the men and women for others. This has actually been played out. I know that there was another question about divesting. And I worked with some students last spring who protested and wanted Georgetown to divest from its oil holdings. It eventually did. And so, and a lot of, I think, why that happened was because of the values that were routinely brought up, and the importance of living our values. Not easy when you look at possibly losing money initially, but they did the right thing, and I was really proud when they did that.
Exactly. And here's a question that goes back to one of our first ones. And I think maybe if you could talk about for about a minute on the work that Catholic hospitals have done on creation care and going green. A question here is the way it was written is, are hospitals getting on board? It would probably like a huge, turning a huge ocean liner around. And I think if you could give a couple of examples of how Catholic hospitals are turning around.
Mm. Yeah, probably the biggest example, in addition to what I talked about earlier about energy use, is the Catholic Health Association has been a leader in this, and is the go-to group for not just Catholic hospitals, but all hospitals to think about community benefits, which are required out of the Affordable Care Act. And many Catholic hospitals have taken these recommendations to look at their community environment, whether it's creating more green space, creating transportation, modes of transportation for people that will require less individual drivers. And so these community benefits through the Affordable Care Act are required for nonprofit hospitals. So how do those hospitals sort of marry the idea of a community benefit as a nonprofit with the environment? Um, there are there are hospitals that have planted trees that have gone above and beyond what we would traditionally think of for community benefits for a hospital setting, and really been very creative, creating farmers markets where people can purchase locally grown food as opposed to buying fruits and vegetables that have been transported from overseas, and all the energy that it takes to get that piece of food on your plate. So there have been all sorts of initiatives around reducing water waste. There have been the nitrous oxide. There are projects in play right now trying to recycle the nitrous oxide. So there's lots of really great examples. I would say the majority are centered around energy, because we're saving a ton of money by doing that, by looking at renewable energy sources. But there are a lot of really exciting ideas that are coming into play right now.
I think we have time for one short question, and this one is going to be probably I'll be answering it because it has to be with creation care teams and how also to move diocesan officials on this issue. And I would say that if you have a great creation care team, you can start prodding to have a diocesan creation care team. It doesn't need to be just a parish. It can also be your diocese. Give me a call, give me an email, send me an email, and we can talk about how to really start prodding this issue out there. I see from the questions and the comments that this is something that a lot of people are struggling with. So let's talk about it. Let's figure out how we can help you really move this into the community. At this point, I am going to be closing because we are at 4 o'clock. First of all, I'd like to extend my thanks and appreciation to Laura. Incredibly informative presentation. And a special thanks to all of you who joined us this afternoon. We would appreciate it if you could take a couple of minutes to fill out a short survey that's going to appear on your screen at the end of the program. and provide us with valuable feedback as we plan future webinars. We do have, as Laura said, a webinar coming up on December 7th at 3 p.m. Eastern. It's called In the Footsteps of the Holy Family, Refugees in an Era of Climate Change. You can register for it if you go onto our website and look for webinars. The registration is there. We hope you can join us. As I said, if you need more information, send us an email at info@catholicclimatecovenant.org. Also, there is our website that you can look at. I can also put you back in touch with Laura very easily. When you get the PowerPoint, you will have her information as well. I want to extend everybody a great thank you. No, I didn't get to every single comment or question. I hopefully will be able to do it offline privately. At this point, thank you all. Thank you, Laura. Goodbye.
Thank you. Happy Thanksgiving.
Yes, happy Thanksgiving, everyone.
Bye.